The PFF is closely monitoring COVID-19's impact on the pulmonary fibrosis community. While there are still many unknowns, we do know there are several everyday precautions you can take to help avoid infection. Currently, the best thing you can do is avoid exposure to the virus and other infections. This means staying home as much as possible, limiting contact with those outside your household, and avoiding non-essential errands, visits, and travel. When you do have to leave your home, practice social distancing by keeping at least 6 feet away from others. A face covering should be worn when in public, especially when social distancing measures are difficult to maintain. You should also avoid touching your face. Carry a small bottle of hand sanitizer that contains at least 60% alcohol in your car or bag. Use this until you can properly wash your hands with soap and water for at least 20 seconds. When you return home, wash your hands as soon as possible. We also recommend washing your hands at these key times. Regular cleaning and disinfecting of frequently touched objects and surfaces can help prevent coronavirus and other contagious illnesses. If you're wearing a reusable cloth face covering, be sure to wash it after each use. Disposable face coverings should not be reused. Pulmonary fibrosis is a chronic disease and requires ongoing care. PF patients should contact their doctor about routine visits and testing, as many clinics are expanding telehealth options. If you feel sick, contact your doctor and follow their care instructions until you're fully recovered. Remember that everyone reacts differently to stressful situations, and that's okay. Take time to focus on yourself and your well-being. Read a good book, watch a show that makes you laugh, or call your family and friends to chat. If you need additional support, contact a licensed mental health professional. Please visit our website to learn more.